Welcome to the Block Center, an international clinic for the treatment of chronic health problems in both children and adults, conveniently located in the Dallas-Fort Worth area near DFW International Airport. The Block Center is the office of Dr. Marianne Block, who is the founder and medical director of the center. Dr. Block is internationally known for her practical and natural approach to family health and learning, and for her special focus on attention and behavior problems and autism spectrum disorder. Dr. Block is a top-selling author of the books No More ADHD, 10 Steps to Help Improve Your Child's Attention and Behavior Without Drugs, and No More Antibiotics, Treating Ear and Respiratory Infections Without Drugs, and The ABCs of Raising Great Kids.
Welcome to the Block Center, where we focus on chronic health problems in children and adults. My philosophy when working with any health problem is trying to find the underlying cause of the health problem and then treating it with as natural approach as possible without trying to just cover up symptoms with drugs. The Block Center is very child-friendly and is set up to accommodate both children and adults with health and learning problems. Our programs include attention and behavior problems, autism spectrum disorder, ear infections, allergies and sensitivities, asthma, gastrointestinal problems, headaches, depression, eczema, fatigue, and in adults, menopause symptoms with bioidentical hormones, adult ADD type symptoms, and our corporate program to help develop skills needed at work, as well as many other chronic problems in children and adults. Patients begin their appointment at the Block Center after filling out a very comprehensive history form and then spending time with me, the physician, to go over that history form and for me to do a physical exam. During this time, I look at the diet, I look at past medical history, and go back in the life of a child even before the child was born. In adults, I want to know when the problem started and how long they've been going on and what was going on in a person's life when these symptoms started. We sometimes find it necessary to do some very specific lab tests, and we often use specialty labs that are focused on looking at very specific things in their laboratory, such as parasites and bacteria for one lab, or nutritional deficiencies with another, or heavy metal toxicity with another. One of the most common causes of chronic problems that I see in my office is allergies. Allergies can cause anything from behavior problems, runny, itchy nose and eyes, asthma, headaches, even depression. And in our office, we test allergies one at a time. And the reason we do this is so that we can determine exactly which allergen is causing which symptom. So if we test all the allergies at one time with skin testing and you get a headache, we won't know which allergen gave you the headache. But if we test one at a time and you get a headache with one of the allergens or two of them, then we know exactly which allergens are causing your headaches. When someone has asthma, we'll actually have them use the peak flow meter between allergy shots so we can determine which allergen is causing the asthma symptoms. This takes a lot longer to do. It can take as many as 6 full days or more, but it does give us a lot more information.
Due to time restraints for our out-of-town patients, we test histamine on the skin and identify other allergies through lab tests.
When you see the following video, you'll see how significant allergies can be when it comes to behavior problems and learning and concentration and focus problems. This is a video of a 9-year-old boy undergoing allergy testing for chocolate. Before allergy testing, he feels good, he's in a good mood, and he is cooperative. So you're feeling pretty good this morning?
Yes.
Any aches or pains?
No.
No headaches?
No.
No stomach aches?
No.
Nothing? Great. In a good mood?
Yes.
The shot doesn't hurt. He uses the noise to distract himself.
It's my turn.
Here we go.
Great job.
All right.
Well, we need you to.
We ask the children to sit still and concentrate for 10 minutes. The reaction to this first allergy shot makes him feel bad. It causes him to be uncooperative, belligerent, unable to sit still or concentrate.
How are you feeling right now, Wes?
Bad.
Can you tell me how you're feeling?
Oh, bad right now.
In what way?
Everything bad. You mad.
She said you can do some reading.
Please. Tell me.
You can write a letter if you'd like. You can write a letter to your
Write a
teacher.
letter.
He is unable to do even the simplest of tasks.
Concentration.
Let's see what we have.
Pretty right.
He continues to have trouble behaving, sitting still, concentrating, and doing a simple puzzle.
Stop it. Got you. Can't solve this puzzle.
After 10 minutes, he is given another dose of the same allergen, but this time it is the dose that makes his symptoms go away.
Good job. Good breath and blood out. Okay.
After receiving the correct dose, he can sit still, he can focus and concentrate, and he is no longer angry or belligerent.
Tell me how you feel.
Good.
Too busy working, huh?
Children can have this type of reaction to any food, chemical, or inhalant. They may react to one or many. The only way to determine which one is to allergy test one allergen at a time. They can then be treated by removing the food or chemical or with allergy shots to stop the reaction. Thank you for visiting us at the Block Center. If you would like further information, please go to our website, www.blockcenter.com, or call us at the office at 817-280-9933. Thank you.